A concussion is obviously a brain injury. It's in the category of what's called a traumatic brain injury, and so there's different severities of traumatic brain injury, and it ranges mild to moderate and then severe. And that's all based on things like the length of time you've lost consciousness, your Glasgow Coma Scale at the point of injury within 30 minutes after the injuries occurred, as well as the length of time you have post-traumatic amnesia. Now, concussion is in the category of mild traumatic brain injury, which means that your Glasgow Coma Scale is between 13 and 15, which a full Glasgow Coma Scale is 15. So you could have a full Glasgow Coma Scale. You have a transient onset of symptoms. So you could have headache, dizziness, nauseousness, fogginess, any number of symptoms that occur either at the point of injury or shortly thereafter, up to, 24 to 48 hours later, even in some cases where people start to experience symptoms, a little bit of a delayed onset. But the symptoms are transient. They tend to dissipate, and there's no objective findings on imaging. So when you look at something like a moderate or severe brain injury, you'll be able to see findings on MRIs and CT scans potentially that indicate that there's been some actual structural damage. Concussion is a functional injury, so we don't have any of those structural markers of damage. And so most of the time, all the time in terms of the diagnostic criteria for concussion, you're going to have normal imaging. Things like bleeds and things like that would escalate the diagnosis in terms of subdural hematomas and skull fractures and things like that. But in terms of the concussion injury itself, it doesn't show up on imaging. So it is a functional a functional injury that occurs outside of the presence of any imaging findings. Symptoms are transient in nature, and they tend to dissipate on their own given time. But in some cases, they obviously don't, and that's where the rehab side of things comes in. But so, I mean, loosely, it's a mild traumatic brain injury, and it's a functional injury. And I mean, it's a lot easier when I have my whiteboard and my markers to be able to draw the picture out that I do for patients, and that's actually in that blog too. So if people want to see that, that's a picture that kind of explains the whole thing. It's an energy deficit. It's a metabolic injury, as what it's called, and it also affects a whole number of different systems, from your autonomic nervous system, your cardiovascular system, blood flow mechanics, your visual system, your vestibular system, and all that stuff. So it's in the mild category of brain injury, but it actually affects a lot of different systems. And so the injury itself, a lot of people have said, well, even though it's a mild brain injury, it's actually not a mild injury at all. It's quite significant.
Yeah, can you explain that Jello analogy that you used in the video? I think that hits home with a lot of people and gives people an understanding physiologically of what it is that's really causing the concussion and what it's not, in terms of just the impact itself versus the stretching of the neurons.
Yeah, the consistency of brain tissue has been kind of equated to Jello. So if you were to take a nice big plate of Jello and have this mound of Jello, and you were to shake that plate, you would see it kind of jiggle and deform back and forth each way. But if you were to kind of zoom in on each little strand of Jello, you would see that they would stretch, right? Kind of like elastics. They would pull apart and they'd come back together, not to the point of breaking, but they would just get stretched and pulled back. And so if we consider the brain to be the same consistency of Jello, and the internal structure strands of that Jello are actually the neurons, which are the cellular cells of our brain. Those cells are getting stretched when that Jello jiggles. So when that brain gets jiggled back and forth, those cells are getting stretched. And so they used to think of concussion as being the coup contra-coup injury. I know probably a lot of you guys have heard that term before, where the brain hits the skull, creating the coup, and then it bounces back and hits the back part of the inside of the skull, creating the contra-coup. And it was really thought of as a bruising of the brain. So even if you go in Google right now, you'll see concussion bruise, and there'll be all these images. If you type in concussion in Google and look for images, you'll see these like concussion bruises, right? But from what we are learning now about what actually happens, or what that injury actually is, it's actually considered now to be a deeper injury. So not occurring to the outer gray matter of the brain, but actually deeper injury happening to the white matter cells and to the axons themselves. So when that stretching occurs, when the brain's jiggling back and forth after impact, that stretching actually pulls apart cells, but at the weakest point. And that weakest point is kind of those voltage gated channels. And so as soon as those cells pull apart, well, you're going to get ions wanting to exchange because of just regular concentration gradients. And so, I mean, the easiest way to think of a concussion is that the impact itself stimulates brain cells and tricks them into thinking that they've just received a signal. And so they all start to kind of fire and go. And so you have these excitation phases where it's this electrical kind of storm that kind of happens within the brain. And that's the first part. But all of that firing burns that energy. And like I was mentioning before, you have this really, really big drop in energy levels in the brain. And anyone who's been around somebody with concussion is going to see that those levels just start to drop and drop and drop. And you just want to go to sleep and you're just really tired after. And so that's kind of the explanation for that.